When you become ill, you hope to be treated, recover, and move on with your life. But what happens when there's a complication, when your body just can't fight the infection? And what is your local hospital doing to prevent such issues? I'm joined today by CEO of Licking Memorial Health Systems, Rob Montagnes, as well as Dr. Philip Savage. Thanks for being here, guys.
Thanks for having us.
All right, Rob, over the past years especially, the media's been reporting that deaths have been on the rise due to sepsis, right? So is this an issue you guys are seeing?
Clearly, I think you're seeing it throughout all hospitals, large, small. I've been on the Ohio Hospital Association board in the past and now the foundation board for the Ohio Hospital Association. We identified this as a focus for Ohio hospitals in particular. I think some of the statistics that might surprise people, roughly 750,000 folks a year have sepsis. And if you would add the deaths of lung cancer, colon cancer, breast cancer, and AIDS all together, they would not equal the number of folks who die from sepsis each year in our country. So it is just a very significant health event that a lot of people don't know what it is or how prevalent it is.
Right, and that's why we have Dr. Savage here, because you're going to tell us, what is sepsis? What are some of the things that people should note if they're having some symptoms of it?
Well, sepsis isn't a disease. It's actually a syndrome to a disease.
Okay.
So you have to have an infection to get sepsis, and sepsis is actually the overwhelming response of infection from your body.
Okay, so what are some of the signs and symptoms we can tell folks to look out for?
Well, fevers, chills, sweats, just the things that your mom told you to look for when you have an infection. And also things that you wouldn't think of, like confusion.
So who is at highest risk? Because you mentioned you have to have an infection, right, to get this?
Right, absolutely. People that are very young, babies, older folks, people that have diabetes, heart disease, people that have infections like HIV, or people that have cancer.
So how do they know when it has turned to that? Do people get this at home and then they come to the hospital thinking they just have a normal infection and find out they have sepsis?
Yeah, a lot of times when people start getting sick and they don't get better quickly and they keep getting sicker and sicker and sicker, it's time to go to the hospital.
Okay, and we do mention it's treatable, right? What is the treatment? Do most people recover?
Yeah, if you get treated early enough, you can recover. And the treatment is fluids and antibiotics as quickly as possible. Okay,
and do you fully recover? Are there some people who are going to suffer, side effects from having sepsis?
There are. If you become really sick from sepsis, end up in an ICU on a ventilator, there can be post-traumatic changes from the sepsis, and they can linger for months and even years.
And is there anything people can do to prevent it?
Get your vaccinations. If you start getting ill and you don't get better, see your doctor.
Okay, so it's as basic as that, but you need to pay attention. Is it kind of a common sense thing if something's happening?
Oh, absolutely. Absolutely. If you start getting sick and you start having signs like fevers, chills, sweats, and they're not getting better and things keep getting worse, yeah, either go to your doctor, urgent care, or the nearest ER as quickly as you can. With sepsis, for every hour that it's not treated, the morbidity and mortality, that's the sicker or the chance of dying, increases by about 8%.
Wow. So you just need to know that time is of the essence if something's happening like this.
Absolutely.
Rob, you mentioned all of the statistics for this, and I think they're pretty shocking when you look at that. So what is Licking Memorial Hospital doing to try and help this situation, to try and prevent these deaths?
Sure, I think a couple things. I can't emphasize enough, perhaps a misconception that this is something you get in the hospital. I think statistically, roughly 80% of the folks come into the hospital with sepsis already, rather than this notion that I develop it in the hospital. So getting back to early intervention, early recognition, so any education we can do is very important. Then we've taken a very aggressive approach in our hospital in terms of developing some technology to put statistics, some clinical measures in the hands of our providers, and we've seen a 70% decrease in our mortality over the past 2 to 3 years,
Wow.
which is tremendous. And a lot of that gets back to that laser focus on treating this and doing it early and making sure these folks have the proper data to make those judgments, make those clinical decisions, and move forward. So it's just something we hope as a state, certainly as a community, we can get that information out there so folks can see this as something that's very treatable.
Yeah, definitely. The awareness needs to be out there, which you are helping with today. So I want to thank you both for being here.
Sure, it's been great.
Thank you.